Hi, my name's Tyler Norris, and I'm Vice President of Total Health Partnerships at Kaiser Permanente. We wanted to do these special issues of the National Civic Review on healthy communities and healthy cities to mark the quarter century of the movement in the United States, and to be able to lift up the results of this work across the nation, some of the learnings from mistakes, how we've converted those into innovations, what the unfinished agenda is for the coming years, coming quarter century, and also to really look at how healthy communities, healthy cities has become almost a DNA of how multi-sector partnerships across the country work to implement their visions, solve problems, and improve their community quality of life. I think readers are going to find hope for our country, hope for our democracy in these two special issues. There are stories from across the nation, from organizations, from funders, evaluators, federal government and local community agencies that have done so much good work. And I think people are going to be uplifted by what's possible and how so many people across the nation are making a measurable impact in the lives of people and in the quality of life in their communities, and how they're creating environments that make it easier for people to be healthier and to thrive and to improve their overall well-being. I think the metaphor of healthy cities, healthy communities is powerful for a few reasons. And I know this from being part of hundreds of visioning sessions around the country over the last 25 years, that when you bring a diverse group of people together, people of all walks of life, education level, perspective, political perspective, and so forth, and you say, what's a healthy community? And what's healthy? And what's a community? It generates such a beautiful conversation about what health is and where health comes from. And not just the role that health care plays, but really the determinants of health and what's upstream from health in the first place in a way that everybody has a place to contribute. And then it leads to what's community and how do we create community and what's my role in community? So that there's a way that by asking those kinds of questions, what's a healthy community, that there's a door in for many, many people. And I think that's a really important part. I also think that the idea of a healthy community moves the conversation from me to we. Of course, there's a role for me, but if I'm going to impact the health of an overall community, I need to do my part, but I need you. And if I'm in the corporate sector, if I'm in the nonprofit sector, or if I'm in the health sector, where I work, I know I need transportation, I need housing, I need the equity lens, I need folks that are working on early childhood development, I need folks who are working on aging. I can't solve those problems myself, that it really takes the whole community. So I think it draws us into an area of we, of an inclusion, of really solving issues more broadly that we can't do by ourselves. And another opportunity area, I think, is around innovation and inclusion, if I will. It's a bit cliche to say, well, we need to think outside of the box, and yet we do. We keep bringing the same people and the same kind of tools together, and we have the same kind of results, and yet we're somehow surprised. I think there's room for some fresh thinking, and one of the ways I think we're going to get there is getting fresh voices at the table, bringing folks from technology, bringing people who are usually we talk about, and there's the problem. Bring them in as part of the solution and really challenge ourselves to think differently and not just go to meetings and say, well, the community ought to do this, but how do we bring that back to our organizations, to our companies, to our neighborhoods, to our places of worship, and change what we're doing for ourselves, for our families, in our organizations, in our own neighborhoods, not just saying, well, the broader community needs to do that. So I think we're going to need to innovate, include, and model it ourselves, like be the change.